Winters in the upper Midwest are brutal. The snow and skyline blend into an ongoing sea of gray, and the wind bites to your core. Yet, this is where many choose to live. That includes Rod Peterson, who's been in production agriculture here his entire life.
I always laugh that I've never had to work a day in my life because I love what I do. Have no intention of retiring until the good Lord calls me home.
But ranching in these elements is difficult. Rod injured one shoulder and needed surgery about 15 years ago. He had to make the 150-mile trip to Sioux Falls for each appointment.
You know, it's not the end of the earth, but it's a 2-hour trip down there every time you go and 2 hours home, and sure kills a day. And when you get out of surgery, sometimes that 2 hour trip seems like forever.
Rod knew what happened when he hurt his other shoulder a couple years ago. This time, he found his care much closer to home. It was a 20-minute drive into Chamberlain.
They did it that morning, and you know, in a few hours while I was back home in my own recliner and everything that I had to do after that, they were right here. And so it saved a lot of days travel, a lot of time.
Just to give you an idea of the vastness of the area that we serve, we are the only hospital that sits on the interstate between Mitchell and Rapid City.
Chamberlain isn't a large community. It sits on the Missouri River and has fewer than 3,000 people. Yet, for this area of central South Dakota, it serves as a medical hub.
This hospital, the way it's situated, and the clinic and long-term care, we provide some essential services to a fairly, I would almost say, frontier area.
So, for those who live where the sky meets the horizon, it's a rare convenience in a lifestyle that demands hard work, no matter the elements.
It's really nice for us to be able to come here and have the same kind of health care and help that we'd get if we drove 150 or 200 miles.
I'm Sean Niestead for Sanford Health News.